we got started down on this path almost 8-9 years ago, initially with some discussions with patient and patient partners who told us that there was a great need for developing a patient tool for people making decisions about treatment. And as we embarked on this journey, we thought we were going to be developing a tool for people with rheumatoid arthritis, which has lots and lots of medications, but patients steered us clearly in the direction of lupus, saying the need was greatest in lupus. So we ended up just transforming our entire idea and project for a condition for which the need was greatest, even though it's much more rare than rheumatoid arthritis. And as we embarked on this journey, we realized that patients had been longing for this sort of information. So we're glad that our patient partners steered us away from a disease that we thought patients would have the greatest need to a disease where patients told us they had the greatest need. So based on those discussions, and obviously we approached PCORI with a research proposal, and then we were very fortunate to have secured funding from them to develop this patient education tool that helps people make difficult treatment decisions about their lupus. So the tool that we have developed with feedback and directives from the patient is based on patient feedback about where the needs are, what information is most desired by the patient, in what form, and in what sort of platforms or settings. So based on this, we entertained the ideas of paper-based tool, a single double-sided decision tool sheet versus a computerized decision tool. And we quickly realized, based on the extensive work we did at several sites with African-American, Hispanic, and white women, that what people need is an individualized tool. Everybody has different needs. A premenopausal 21-year-old female with lower socioeconomic status has a different need than an 83-year-old lupus patient who's been using medications for 30, 40 years. A male with lupus has a different need than that of a female with lupus in terms of knowing about side effects of certain drugs, in terms of having children and or other things. So those sort of things helped us decide that this would end up being a very easy to use computerized touchpad, either on the phone or on a touchpad in the clinic tool that patients can access at any time and as many times as I like to access. In addition, it needs to allow people to take this tool and then go through some critical key information, but also be able to delve into individualized themes. So do they want to see information on fertility? Yes, no. Do they want to see information on steroids like prednisone? Yes or no. Do they want to hear more about treatments for skin disease, new drugs, and those sort of things? So there are many aspects of the tool that allow people to go into as much depth as they want or have it as brief a tool as they need. So what it does do for patients is allow them to access this information at any time, at any place, at a time of their choosing, based on their needs at that particular time. It allows them to go back and access a more detailed information at any point in time. It currently has all the approved treatments as part of that information system, including the most recently approved lupus drugs. What it cannot do is make a decision for a patient. And I don't think we ever intend the tool to be like that. I think we still believe in our heart of hearts that the decision is extremely individualized, even beyond what we present in the tool, and is an active discussion between the physician and the patient. So in other words, this remains a tool, this remains an educational information system, and it remains a way for physicians and patients to have a discussion, to have a context of discussion, and to help raise important questions for both the patient and physician. So that's what the tool does. What the tool probably cannot do is take into account experimental treatments at this time. Um, Also, a lot of patients may use supplements and may hear about diets of different kinds for which the proof does not exist for treatment of lupus. We don't have those aspects of non-pharmacological treatments in the tool, so it does not cover that. We believe it's an important aspect, but given the scope of the project and the lack of scientific data for those aspects, we're unable to cover it within this tool. I think another important aspect that I would have liked to cover it in the tool, but we decided not to include in the tool because we didn't want the tool to get too lengthy, are things about exercise, smoking, and body weight BMI. Those are important aspects of health that apply to lupus patients just as they apply to any individual. So everything that is recommended for a heart patient, for an average healthy individual, also apply to lupus patients for exercise, smoking, and body weight. But those are certainly things that the tool does not cover. I think the way we have viewed this tool is for this to be one of the ways to assist the shared decision making. So as you know, shared decision making is a process, and that process can be very different for different people and also can be different for an individual at different time spans, lifespans, and a different disease presentation at that given time, and how complicated that presentation is. So it's the decision making, we believe, is a process that every patient takes up with their provider, and sometimes multiple providers. And we believe that this tool helps contextualize the discussion, bring specifics to the patient that is known through the scientific data on a population level, bring that data to the physician and the patient in words that patients can understand and relate back to the physicians. And I would almost envision this tool to be prompting meaningful discussions that stem from knowledge and curiosity, rather than fear from just having heard that this drug is anti-cancer drug, or this drug causes a horrible side effect, or somebody having had experienced that and posted something on the internet or otherwise, and leading to an irrational fear for that patient. So I think that this tool, by providing balanced scientific information in words and figures that most people can understand, regardless of their educational status, regardless of how many years of schools they've done, regardless of their socioeconomic status, regardless of what they have access to or not. We believe that as phones become universal and as internet access becomes universal, even people who don't have access to healthcare and clinics hopefully will be able to access this tool and be able to even know in some cases that they need to access healthcare or a provider, but also be able to have this information ahead of their clinic visit. So we believe this to be both synchronous and asynchronous with their healthcare visits. We believe it to be a tool that assists them start discussions. It is also possible that for some patients, based on the information we have, that they will use this tool and some information directly to review with the physician as they make a treatment decision, because we have provided those specifics and explanations of simple things like, what is a kidney? There are people who may not understand what a kidney is. And we as physicians assume that every patient knows what a kidney is, what it does. And we start our discussion by saying, lupus affects kidneys and it shuts down the kidneys and may put you in dialysis. Many people have no idea what dialysis is, what it means for their life, what it means for their family. So to be able to explain simple words like dialysis or kidney, or what is a lupus kidney disease as part of this information system, I believe makes it very user-friendly for people who are suffering from this disease. Right. So, why would a provider want to use this in a busy practice, because anytime we talk about practice in our settings, time is limited and there are always more things to do. So I believe that um, probably the biggest attribute of this tool is it's a self-administered tool, meaning that patients can access it on their own um, at a setting of their choosing, um, wherever they want. So I would assume that one provider might use it in one of several ways. So think of a provider seeing a lupus patient for their second return visit or their fifth return visit or their 20th return visit. And they just got a lab from last week that shows that now they have protein in the urine and they might possibly have kidney disease, or they definitely have kidney disease they didn't have before. And the physician has gotten that lab and has just sent a lab letter to the patient and said, hey, Miss D, I see that urine has some abnormalities. I'd like to see you in the clinic next week. I will discuss this and treatments with you. Why don't you go ahead and come and see us Monday at 7:45? Instead of that message, it will then say, also, please look at this information system in the meantime. That will facilitate this discussion about potential treatments. And they would have a link and or the free website or the free phone app link to this decision aid. So then the patient looks at the decision aid, and obviously the decision aid prompts at the end for the patient to write down their questions for the physician that they have, the doubts they have. So the patient might come to the clinic either with the questions in their mind or jotted down on their on a piece of paper or in the notes section on their smartphone. And then the discussion just starts with clear confirmation of the diagnosis, and then true discussion, in-depth discussion of risk and benefits and alternatives, and then weighing that in context with that particular patient. So it advances the discussion instead of a 45-minute discussion where you're starting from what is lupus, what's kidney disease. Perhaps those things are already much clearer, and you are starting with discussion of why I should take Imuran or Cellcept and not steroids and those sort of things. So that's one context. That's how physicians can use it. It does not cost them any time or money. They use it to shorten their visit and make it very focused. Imagine that the patient just comes to the clinic and this is their 5th year of following up with lupus in the clinic, and the patient says, I'm not sure, doc, what my diagnosis has been, and I've always wondered about, and the physician goes like, oh, I have discussed this a few times with the patient. As you can understand that, there's not infrequently a gap in communication between patient and physician and their understanding of the disease the patient has. And we do face that, and there's also issues with some, sometimes cognitive deficits and CNS disease, lupus, that also affects memory of lupus patients. So the patient is in the 5th year of the disease, but somehow they are not at a good understanding of what the disease is. So the physician can say, hey, I understand, Ms. D, that the discussions we may have had with lupus had not been clear. I understand you have a question about what your disease is. Why don't you look at this? Why don't you look at this iPad for 5 minutes before you leave the clinic, or have a seat in the waiting room, look it over, and then see if you have questions that you want to pursue at the next visit or want to come back and ask me questions. And we'll just have a follow-up visit with you to further discuss it, or I'll have a telemedicine visit with you that we can discuss about this disease. And I understand that we don't need any treatment decisions, so you can go through the first 5 minutes of this and read about the disease, and we can talk about it. So again, it's a tool that does not cost physician any time. It probably costs the staff about a 10 seconds or 15 seconds to light up an iPad, which are becoming universal, and again, assist the information to the patient. We also have been using this in the hospital setting. You have a patient who's 21-year-old, was healthy, came in, has got lupus kidney disease, has fears of all kind of lifelong medication affecting their fertility. These are anti-cancer medication, not just be on steroids. Well, they get this iPad and they learn about this rather than reading all the social media posts about what these dreaded drugs can do to them. And they're dreaded because people have shared their negative experiences that are shared much more often than positive. on the web. And those are true experiences, but sometimes a bit imbalanced on the web and social media. And they're success stories, but they don't draw as much likes as the stories of all the horror stories of medication treatment. So this then provides them with some information. So if they go home even without a treatment decision making, they then come back to the clinic with a much more balanced view of all the treatments and can have the shared decision making. So those are the settings. Those are just 3 examples of these settings that people can do this. Now, all of those things that we're doing with an iPad can be simply replaced, hopefully in the next few weeks, with a phone app that we're testing and launching again, thanks to PCORI to provide us the funds and the resources to do that, which then will make this decision aid a free Android and a free iPhone app. Now, we would have to put in some resources in the future to keep updating them, because information in the medicine gets outdated with new medication approvals or knowledge of new side effects of medication. So we'll have to seek some additional resources on an ongoing basis to keep it updated. But then again, this becomes available to anybody who wants to learn about this disease and its treatment. And I would hope that more people use it, because there'll be a freely available app with no cost to people who have a smartphone. And hopefully in the future, people would come up with technology to even make this available beyond just a smartphone, so that again we remove that additional barrier from people who cannot afford a smartphone. So those are the ways that I think providers can certainly use it in terms of prompting a discussion and a more informed, balanced discussion. And obviously, the system exists free of cost to them and would not require them to invest a lot of time. In fact, I believe will save them at least a few minutes to hours of discussion when it comes to treatment decision making. In conclusion, I'd say that first, we are so indebted to all the patients who helped us put our head where it should be. They kept us grounded and told us exactly what they need in the decision aid. So I'm eternally grateful to all the patients who gave us hours and hours of feedback during qualitative work, so that we could develop a system by patients for patients. So I think we wouldn't be here without all the hard work that patients did to provide us with these narratives and to provide us with a way to think about this information system that we wouldn't have come up with just as providers and researchers. I think PCORI, in its commitment to research that helps the patient directly, is also to be thanked a lot for this, for initially funding us and then funding us to get this out in the clinics and see how we can figure out various ways to implement it. Because research that we do to find out something works or doesn't work is only half as helpful if we don't know how to get it implemented, if we don't figure out what will work for different groups of patients. So I think I feel indebted to PCORI as well for this. And finally, I think all the site PIs across several academic centers who've allowed us to use their clinic populations to provide this to their patients and learn from how we can implement and disseminate this tool widely, as well as collaborations with ARDA and other organizations who are deeply interested in informing and educating patients. I think these are critical aspects of taking this from an idea to something at the palm of patient's hand at all times. Unfortunately, these things called phones are in our hands now all the time, other than sleeping time. But we can take advantage of that fact that we can also make very helpful healthcare decision-related things available at the palm of patient's hand at any time that they choose to look at this. So I believe that technology, as well as all these stakeholders we've had all along the path, and we'll hopefully continue to collaborate with all of them, will make this decision tool, hopefully available to every lupus patient in the world to help them make decisions. We hope to be able to translate this into multiple languages. We hope to be able to have narratives on top of information. I know we only have this in English and Spanish at present. So fortunately, patients who understand English and or Spanish can access this tool. And we truly hope that in the future we can, with the help from PCORI and other organizations, be able to translate this into multiple languages to reach every human being with lupus and make this tool available to them. So that's what I would say in conclusion.